What are doctors and what are they prepared for? Hello, invisible friends. I am Logo and I want to share with you what are doctors and what are they prepared for. Doctors are professionals who have completed the corresponding university degree and are authorized to practice medicine. In addition, a doctor is a person who has obtained the academic degree of doctor and is authorized to diagnose diseases and prescribe specific treatments. Physicians are prepared to perform a variety of important functions and activities in their workday. Some of these features include: conduct primary care consultations, request complementary tests to confirm diagnostic impressions, record the data of the patient's interrogation and physical examination, monitor the patient's adherence to their basic treatment, coordinate referrals to other medical specialties. Simply put, a doctor is the specialist who specifically treats a disease or pathology. A person with a condition or health problem seeks treatment to improve or cure the condition. Without affection, there is no possible consultation with a doctor because we are healthy. A doctor is not a mentor who guides you towards a life free of diseases or pathologies. A doctor is not a prophet of our health. He uses science to improve a condition, and if this condition does not appear or does not exist, he would be the inverse of a hypochondriac. To detect a condition, it is important to mention that each infection may require a different diagnostic approach, and the process may vary depending on the suspected infection. For this, corresponding tests are carried out to confirm the problem. These can be lab scanners of all kinds. The list of processes is extensive, but the fundamental thing is the final diagnosis once a pathology is found. Without detected pathology, there is no recommended treatment. Therefore, healthy people are not treated. A hypochondriac is a person who has an anxiety disorder known as hypochondria. This disorder is characterized by an obsessive, irrational, and constant preoccupation with health. Hypochondriacs are convinced that they have or are developing a serious illness, even though medical evidence does not support this belief. Hypochondriacs interpret normal bodily sensations or minor symptoms as signs of a serious illness. For example, they may interpret a common headache as a sign of a brain tumor. Some of the typical symptoms presented by a hypochondriac would be constant worry and fear of serious illness. Worry and anxiety persist after medical appointments. They are convinced that they have a disease. The concern stems from the hypochondriac's interpretations of his bodily sensations. They are hypervigilant to other symptoms that may be indicative of illness, which for other people would go unnoticed. It is important to mention that if you or someone you know exhibits symptoms of hypochondria, it is advisable to seek medical attention immediately. But it is a psychological disorder characterized by excessive concern for health. A psychologist is a professional who engages in psychological intervention, that is, the treatment of patients with personal or social problems. Psychologists have professional training that allows them to help people cope effectively with life and mental health problems. If you liked the video and want to help spread the word, remember to click on the bell and subscribe to receive more information like this. Remember that step by step we can improve. The worst thing is to do nothing. Invisible friends, we see ourselves in the mirror